Good morning. My name is Tamika Smith with Florida Voices for Health, and I'm joined today by Ann Swirlick, who's a Senior Policy Analyst at the Florida Policy Institute, and Jody Ray, who is the Director of Florida Covering Kids and Families. How are you ladies doing?
Great.
We're doing well.
Good. Can you both just tell us a little bit about your organizations?
I'll start. Florida Policy Institute, our mission is to advance state policies and budgets that improve economic mobility and quality of life for all Floridians.
Okay, thank you, Ann. And Jody?
I'm with Florida Covering Kids and Families. We're an initiative in the College of Public Health at the University of South Florida, and we have been working on outreach, enrollment, healthcare access issues statewide for about the last 20 years.
20 years.
And
wow.
we spend, I'm sorry?
I said 20 years, wow.
20 years, yes. And so we spend all of our time around connecting people to coverage.
Okay, and Ann and I are very familiar with that Navigator program. So thank you both. We appreciate you joining us today. Today's event is hosted by Medicaid Matters Florida. We're a coalition of advocates, providers, lawmakers, and Floridians working to protect and expand access to care for low-income Floridians. Now, it's no secret that the healthcare system was already a bit of a complicated mess even before the current public health crisis. Many people are expected now to find healthcare and are very surprised at the situation that they're in. So they're trying to apply for coverage through the marketplace and for Medicaid. So this is true for so many Floridians who've recently lost their jobs. Our goal today is to leave you with helpful information, including how to get enrolled in coverage in the marketplace and Medicaid, an explanation of what healthcare policies have changed recently. And last, we want to look at the policies that Florida legislators can put into place to address the crisis and how Floridians can get active. Although this video is pre-recorded, we are live in the comment section. So if you have any questions, please put them in the comment section and we'll be answering them in real time below. So let's go ahead and get started. Okay, Jody, first I'm going to start with you. I think it will be helpful to refresh the memories of people who are at home. Can you give us a quick overview of what the marketplace is and what its relationship is to the Affordable Care Act? And how can people, is it possible for them to get coverage through the ACA or going private to the healthcare health insurance companies?
So the health insurance marketplaces were a part of the Affordable Care Act, the ACA, to allow people to shop for coverage in a way that might be more affordable than shopping out there in the private market, particularly considering how it had been up until the ACA was passed. So the health insurance marketplace basically is a place where you have a bunch of plans. In every state, it looks a little different. In some states, there's a state marketplace that are run by the state, and many states are participating in what is known as the federal insurance marketplace. And people can go online, they apply for coverage, and they also get screened for financial assistance to help pay for that coverage. So, for example, when they apply, they might get looked at to see if they're eligible for premium tax credits, which bring down premiums for individuals, their monthly payment for their health plan. And many people also qualify for cost sharing reductions. And those cost sharing reductions bring down the other out-of-pocket costs that people have when they buy coverage. Things like co-insurance, co-plans, co-payments, and deductibles. Things that, you still have to pay out of pocket even though you have coverage. And so those that qualify might get both, but that's the benefit of applying through the health insurance marketplace.
Okay, and in Florida, we are part of the federal, right? Because we don't have our own marketplace. Okay, so folks would actually have to go to healthcare.gov
Healthcare.gov.
to do the application. Okay, all right, awesome, thank you. Now, we know that right now there are tens of thousands of Floridians who recently lost their jobs, and many of them had jobs where they got health insurance through their job. So what are their options? If they've lost their job, they've of course lost their health insurance, can they enroll in a marketplace plan?
Yeah, I think it's real important for people to remember that the way the health insurance marketplace is structured is that people have to project their income for the year. So and understanding that a lot of individuals have variable incomes, that it's not they're not receiving a paycheck every week that's the same amount of money, right? Some people could earn all their money for the year in the first half of the year. And so what we've been telling people is don't assume that you cannot apply. I think it's real important to look at not only the income that you've earned, but the income that you really feel pretty strongly that you're likely to earn for this year too. And a lot of times that income can still make you eligible, particularly for the cost sharing and tax credits, but for the special enrollment periods, which is, there are a list of qualifications that are on healthcare.gov, life change things like change of jobs, loss of insurance, moving, divorcing, getting married, all those things can trigger special enrollment opportunities. So one of the things that we're finding is that people are able to get in, particularly around, first of all, loss of MEC compliant insurance. They were enrolled in a qualified health plan, but because they maybe lost their job, or in some cases, people have to work so many hours, particularly when you're in unions, to be able to retain health insurance. So they might lose it for that reason. People are experiencing changes in income. I think a lot of these things are really important for people to try to sit down with somebody who understands how to navigate the marketplace to see what they qualify for. We're seeing a lot of people who might already be in the marketplace, but the change in income can trigger a change in their premiums, and then suddenly make them also eligible for cost sharing reductions. So keeping that information up to date in the marketplace plans is also really important, because particularly where people are maybe struggling right now, but they have a plan, specifically in the marketplace, they may find that they can have that same plan suddenly become more affordable for them and their family.
Okay. And you hit on some really good points there. I wish I had a pen and paper. I could write it all down. Because you said about the special enrollment period. I know most people think that, well, I can't apply right now. It's not open enrollment, but it's not open enrollment, but you may have a life-changing event, which losing your job where you had healthcare insurance is a life-changing event. It automatically will trigger you to qualify for this special SEP, special enrollment period is what you're talking about, right?
Yeah.
So,
yeah.
Okay. And then so people should, the other important point you mentioned was the projecting the income, because I talk with a lot of folks who think their initial question is, so do I have to have my tax return information from last year? And is that what I use for my income for the marketplace? And I have to tell them, no, that's not what you do. You're projecting for the year. So for those people, we're in April now, they would say, okay, this is what I made January through April, and then project what they plan to make April through December. Is that what they would do?
Yeah, honestly, right now, the way I'm communicating to consumers is January to whatever day they've stopped earning an income.
Okay.
And then I am actually recommending that they look at June, the beginning of June, as a more, it's all, first of all, it's all a guess, right? Every time we do an application, you're projecting your income. So barring the virus aside, no one always knows
Right.
100% what their life is going to be like in September now.
Right.
So, you know, you're always doing that, but you know, we want people to make an honest, credible estimate. Assuming, you know, things open back up. For example, one person I talked to was a bartender. All right. Well, obviously the bar is closed right now, but you know, if everything goes and opens back up again, you know, she'll probably be a bartender again. And so she has some idea what her earnings look like when she's a bartender.
Okay.
I would imagine they'll probably be pretty stupendous after being locked in the house all this time, you know.
Yes.
So I say, you know, looking and knowing that we're shut down to the end of April, and honestly, realistically, nobody knows if we're going, everybody's going to be able to go back out the door on May 1st. I say let's pick June. It's a little further out, maybe has a little bit more realism to it, and then estimate your June to December income. Now, one of the things that I do really emphasize, though, and this is always so important to anybody who's projecting their income, if your income is higher than you project, it is so important that we update that for one specific reason. If you don't, you're taking tax credits now for your premiums that you are going to owe back next year. And I really, really want to do all that I can to protect consumers from being in that situation. We've seen people who have done their own application, didn't use a navigator for assistance, and they, you know, $3,000 later, they owed tax credits back the following year. So always, like, that is the thing that we're really driving home, is that's fine if we underestimate it. You know, it could be to your advantage and that you'll get those tax credits back. But if we, if we overestimate, but if we underestimate, we don't want you to get hit with that. So let's make sure that you keep track of that. Here's what you're projecting. You know, if you're going to make more than that when you hit that point. So we just want to keep that up to date.
Okay. And with the special enrollment period, so somebody goes in today, they lost their job March 15th, and they go into the marketplace, they want to apply, and so they qualify for special enrollment. What documentation do they need to be able to have on hand to send to the marketplace to prove that they lost their job on March 15th?
Well, I have to tell you, I've done quite a few applications in this crazy environment that we're in now, and none of my applications have been asked for documentation.
Oh, wow. Okay.
So I think it might depend on the type of special enrollment rationale you might be going in under, but I haven't had a single eligibility letter that's come back asking for additional documentation.
Okay. And if it does ask for documentation, will the marketplace tell you exactly what they need? If it's a W-2 or some information, a letter from your employer, they'll tell you exactly, right? If they need something specific.
Yeah. So when after you finish filling the application out, before you enroll in a plan, you get it produced. There's an eligibility letter that's produced, and it tells you what your tax credits are, and if you got cost sharing. And it will also say next steps if you have to produce any documentation. But I personally, that's not to say that's 100%, but in the applications I've been doing in the last couple of weeks, I haven't had any documentation.
Okay. All righty. Let's talk about this issue of COBRA, because people that I talk with will often lose their jobs. If I lost my job on March 15th, and with that job went my health insurance benefits, but my job offers me a COBRA package. That the health insurance is typically more expensive, but if they offer it to me, do I have to take it, or can I still go to the marketplace?
Yeah, you can go to the marketplace.
Okay.
You are not required to take COBRA. Sometimes, and I have to tell you, I mean, sometimes depending on the circumstances, going with the COBRA could be a good choice. Okay. What I always tell people to do is, well, one, obviously they're always looking at the premium as in the first instance, but it's also helpful to compare the plans. sometimes for the cost, and depending, and it's always dependent on the individual, right? I mean, there are a number of factors that could make a marketplace plan unaffordable. So I always try to do that, compare your apples to apples to see which is your better deal and the circumstances of the individual. I mean, a lot of times I see with people who do keep their COBRA, they often have had some maybe chronic health care issues that they know this health plan has covered and met the needs for the coverage for that healthcare condition, and they're very hesitant to make a health plan change. I think everybody's got to make an individual decision on that.
Okay. So don't automatically, when you get, for folks who have lost their health insurance and lost their job, don't automatically write COBRA off and say, no, I'll go to the marketplace. Take the time to compare the two, right? Okay.
That's always my recommendation, always.
And let me ask you this question along those lines. If I get the COBRA information, if I go into the marketplace and I do an application and I can see the different plans, I see what type of credits I get, cost sharing, all of that, do I have to take that plan? Do I have to pick a plan? If I go in, I do the application just so I can compare what's going on with COBRA, do I have to click, yes, I'll take this plan in the marketplace?
I mean, first of all, there's a window shopping tool that you don't even have to go in and do an application.
Okay.
So healthcare.gov has a window shopping tool, and you can enter in. It basically will ask you the kind of questions that will affect pricing. And so you go in to see plans and prices on healthcare.gov, and you can do it without actually having to set up an account.
Gotcha.
But once you fill out an application, there's no requirement that you enroll.
Okay. Okay. That's good to know. So there's a way for them to go and window shop and look at plans and all of that so that they have the information to make the best decision for themselves and for their families.
Correct.
Okay. So, Anne, there have been a lot of healthcare policy changes in the wake of COVID-19, some that haven't even happened yet. One of the questions is whether or not the federal government is going to reopen the ACA marketplace at healthcare.gov and create like an open enrollment period all over again instead of people having to go through special enrollment. What's the latest on that?
Well, unfortunately, the latest that we've heard is that it's very unlikely that the federal marketplace will reopen. And I know there's been some confusion because there are a number of states that run their own marketplaces, and many of those have chosen to reopen as a response to this crisis. Now, as we've talked about, a main takeaway we want people to have is if they lose their job or if they've lost their job and they've lost their health insurance as a result, they can still go on the marketplace through a special enrollment period. For people who were uninsured previously, didn't have insurance either while they were working or not working, and they did not enroll through the last open enrollment, which was last fall, they're going to have to wait until the next open enrollment, which will not be till November 15th of this year. I know that can be maybe a hardship for a lot of folks that are uninsured. And we do want to provide people some possible resources or options of what they can do if they do get sick. One of the things that is an incredibly important resource for people are federally qualified health centers. You can go online to, and we'll post, I think, this information later, but the Florida Association of Community Health Centers has on their website a list of all of those centers that exist around the state, and they typically offer services, primary care services on a sliding scale. Your county health department, there are 67 different ones around the state. They all have different services that they may or may not provide. So you have to check with your local county health department to see what kind of help you could get there. They are one of the go-to places if somebody feels like they need to be tested for COVID-19. So that is one of the first places to turn to find out more where you could get testing. And then, of course, there's if you have a 211 program in your area, you can dial that and find out about local resources.
Okay, thank you for that. So if I lost my job on March 20th and I didn't have health insurance coverage on my job in Florida, there's really nothing that I can do in terms of applying for the marketplace. I'm not able to go through the marketplace right now. I have to wait until November, right?
That's right. Unless, if there are some other changes in your circumstances, and Jody could respond to this if I'm giving the incorrect information, but if you have another life change, you might be able to get a special enrollment period based on that change. But if it's because you've lost your job and you've lost your health insurance, you can qualify for the special enrollment period, but if you are already uninsured, you're not going to be able to go on the marketplace.
Okay. All right. Thank you for that.
It is important to remember there are some populations that can get into Medicaid. We are seeing parents who are losing jobs, and Medicaid, I think it's important to remember there's a difference in the way Medicaid, CHIP, and the marketplace look at income. And, so the marketplace really is looking at your projected income, whereas Medicaid and CHIP are going to look at your income here and now when you apply. So we have seen, and I have done enrollment for people who had jobs, steady income, and now do not. And so, these are parents.
Tamika, I just wanted to go back to a really important point Jody made that I just want to make again, is that people can apply for Medicaid or for the Kid Care program at any time. They don't have to wait for an open enrollment period. So if you're a family and you've lost coverage for your children because of loss of a job, or even if you've been uninsured and you want your kids now to be on a plan, you can go ahead and apply at any point in time. So that is another option for people who are uninsured at this point.
Okay, so we want people to definitely know that the marketplace is not the only option. It's particularly important if you have children. Is that what I hear you saying? If you have children, you may be able to, you should go to the Medicaid site and apply for Medicaid.
Right, if you go to Kid Care, and the eligibility for children, the income levels is much more generous than for adults. So so your child is very likely to either be eligible for Medicaid or for another Kid Care program like Healthy Kids.
Okay. Good information. Thank you. Jody, tell us a little bit about the tax credits and the cost sharing reductions. You spoke a little bit about those, but how do people know whether or not they will help them pay for their premiums through the marketplace?
Well, like I said before, you can look at the window shopping tool on healthcare.gov and enter in the relevant information that it asks, and it will tell you what the anticipated cost sharing and tax credits are for the health plans, and you can see the plans. And you also see that when you do your application, it shows up in your health plans. It'll tell you what your in your eligibility letter, how much your tax credits are. And then when you look at the plans, it'll tell you what the plan price is. And it'll tell you what minus your tax credit and what you pay.
Okay. All righty. That's good to know. And so for people who already are in a marketplace plan, they're getting some tax credits and they lose their job, their income drops, they can't afford the premium anymore, what should they do? I think you talked a little bit about this in terms of communicating with the marketplace.
Well, I think it's essential for us to go in and update your account with the income. You really want to do that because it could be really to a person's benefit or family's benefit to do that, because you know, you could bring down your not only your premium, but you could potentially find out you qualify for cost sharing if you didn't already have it.
Okay.
And that will change, that will reduce your deductible and your co-pays and your co-insurance. So that could go a long way in helping somebody at this moment.
Okay. So when you have a change, let the marketplace know.
Right, or call a navigator.
Or call a navigator. Yes, call a navigator. Yes.
Yes.
So let's talk a little bit about the economic impact payment from the federal government that's due any day now, the stimulus that's coming to families. Does that count as income, and is it make it harder for me to get a marketplace plan? Or for Medicaid, does that income, is it going to count as income for me?
So is that an and question?
I think it's both. I think if you, either anybody that wants to jump in, and if you got it, does the economic impact payment that's coming to families, is that going to count as income?
My understanding is it will not, but I want to confirm that. Jody, is that your understanding?
That is correct.
Okay.
Okay. So the stimulus that's coming to families is not going to count as income for this year for families. Okay, so that's important to know, especially for people who are having to project their income. If they're applying for a marketplace plan, they know not to count that. And this is a good time, I think, to plug the Florida Covering Kids and Families program and the Florida Navigators, because that's in my opinion, it's really the best place to start if you have questions about, do I apply for Medicaid? Do I qualify for tax credits? I'm a college student. All of those questions I found navigators are able to help people navigate the system in their particular situation. Is that right?
Right, because it can get really complicated. It seems like it shouldn't be, but it can be. Even when you're talking about financial assistance from for you know, school, you know, how much of that it goes towards housing and books versus, you know, so how to figure out how much gets count as income, you know, when they get scholarships and stuff. So it's not as straightforward as we'd all love it to be, and that's why it's really helpful to have somebody who's accustomed to it, you know, kind of knows how to break down how to report the income and what's relevant, what's not, and it, you know, it can be a little overwhelming for some people, for a lot of people, and that's the purpose of the navigator.
Okay. Yes, thank you. And so to get in contact with somebody, to get enrolled, to get help, navigating the system, they go to coveringflorida.org, right? And the number 877-813-9115. Okay.
Yep.
Contacted with somebody.
And that's for the entire state of Florida.
Entire state of Florida. Gotcha.
Correct.
Okay. Now, Ann, let's jump over to Medicaid a little bit. When it comes to Medicaid, which is a health insurance program for low-income Floridians, what does it take to qualify for coverage through Medicaid?
Well, first, it's important to note just having low income in and of itself is not enough. In Florida, we have an extremely restrictive program where only if you are in certain limited circumstances and within certain income limits can you qualify. And in large part, that's because our state, unlike 37 other states, our state has decided not to expand its Medicaid program to low-income adults ages 19 to 64. So what that means is, for example, if you're a single person, an adult without minor children, you cannot qualify for Medicaid, even if you have no income. If you are a parent of a minor child, you have to be extremely low income to qualify. For a household of 3, for example, If your income is over $7,000 a year, you're not going to qualify. Um, the only other exceptions where you might be able to get coverage are if you're a pregnant woman or if you have a severe disability. But even people with disabilities, if your income is above 88% of the poverty level, which is just $11,000 a year for a single person, you will not qualify. So this is, this illustrates why more than ever we need to be expanding our Medicaid program, and we project that, or experts have projected that over 800,000 low-income Floridians would be able to qualify if we did expand our program. And that's so critical right now during this unprecedented pandemic.
Right. I know I heard that number recently, the 800,000, and that's close to 1 million people in the state that would qualify and have access to health coverage if we expanded. So that's a huge amount of people. So for those people who would like to apply for Medicaid at this time, has the Department of Children and Families done anything to make the process smoother so that it's easy to get into the system and get coverage?
Well, they've taken a few steps, but by and large, it's extremely difficult, especially at this point in time where their customer service line is overwhelmed. They're supposed to be able to take applications by phone, but I've rarely heard of anybody being successful in being able to do that. The one thing they have done is they've extended the time for people to get in their paperwork that would be needed to process an application. So if you apply, say you applied April 1st, you will have 120 days from April 1st to get in whatever documentation, verification information they need. But it's important to note that during that 120-day period, even though eventually if you're determined eligible, it will go back to the date your application or the month your application was filed. But during the time the application's pending, and you might be needing medical care, you're going to be asked to pay out of pocket because it will not show that you have coverage during that time. So it can be a helpful step for people, but there's so much more that we think the department could be doing to streamline the application process and to help people keep their coverage. And we actually, I'll put a plug in, Florida Policy Institute and over 40 other organizations wrote to the governor and agencies, including a number of recommendations on all the safety net programs. But there's a lot of work that could be done around that to make it easier for people to get coverage.
Okay. Now, Jody, I know you're helping people on a daily basis apply for Medicaid coverage. Do you have any advice for people who are going through that process?
Yeah, I think somewhat. I think it's really important that anyone who's applying or working with somebody who's applying to make sure that you've got your Access account login, because if you're needing to submit documentation, it could cut down on the processing time if you can upload it straight to the account and not mail it in or fax it in at this point, because at least you're getting it right on the account. So I would say ideally that is really important. I think people are still trying to fax in documentation, and I think I at this point think that's a mistake. I think you should try to upload it directly to your account. I try really hard when I'm doing an application either for CHIP, Medicaid, or the Marketplace. I make it a point to have the consumer have their all their information on hand, and before that application's closed out, I've uploaded whatever is needed. just because that will cut down on the time. Otherwise, you're waiting for a worker to get into the account, and then they send out a letter, and then you have to respond to the letter, and you could save all of that time and really cut down the interim communication by just getting that uploaded right away with the application.
Okay. All right.
It's just a little trick of the trade.
Okay, that's good to know. That's very good to know. And so are your navigators, are they helping people with all of those applications, the CHIP, the Medicaid, and the marketplace? Okay, so they can go to the website and get that information. That's good to know. Okay.
Yes.
And for people who are currently enrolled in Medicaid, but they're worried about losing their coverage or their children's coverage, let's say they're supposed to recertify soon, like they're supposed to do their recertification on March 30th. But DCF, the office is closed. Some public libraries where people would access computers, those are closed. What can they do? Do they need to be worried and concerned about that recertification date?
Well, they're not supposed to be right now. Under some of the modifications that DCF has made, they're not supposed to be doing, as far as they're concerned, they said they're not doing research for 6 months. So they're supposed to be holding off on that. Now, the CHIP side of things, they did not institute the same policy, but they are allowing people to request extensions on renewals or submission of documentation. But Medicaid is not supposed to be dropping anyone or requiring recertification for 6 months. And I'm trying to think if there was anything else. I mean, that's a big thing, I think.
Okay, and that's good to know that there's a difference. If you have CHIP, that they did not put this extension into place, but for Medicaid, there is an extension. And did you want to jump in with the recertification? Has anything else changed, or should we be watching for anything with recertifications?
Right. Well, the only other thing, I know it's very confusing because during this public health emergency, and this is as a result of the new federal law that was enacted, there is not supposed to be any terminations of Medicaid coverage. I mean, the only exceptions are if somebody moves out of state or somebody requests that their coverage end. So that's a great thing. That's one of the best things in terms of making sure people have health care that's come out of the relief packages to date. So frankly, it makes no sense whatsoever for the department to be doing recertifications. And while we're happy that they've extended the time to do that, and actually I saw something I think that said that they've singled out people who are due to recertify April and May, that those have been postponed. I'm not sure about somebody March 30th, by the way. They don't come under the direction that I saw from DCF. But bottom line is, if you had coverage if you were covered on March 18th, the date the law was enacted, they cannot terminate you from coverage, even if you didn't do your recertification.
Okay.
That's the main message here.
Okay, that's good information. Good to know. You talked a little bit, Ann, earlier about how restrictive Florida's Medicaid system is, and you have to have children, you have to meet income requirements, you have to be pregnant or severely disabled. So tell us a little bit more about that. Who else is that it? Those are the limitations of our Medicaid program?
Right, and one of the things people have been hearing about is the coverage gap, because there's a group of people, nearly 400,000 people in Florida. They're part of that larger group of uninsured people that we talked about, the 800,000, but 400,000, they're caught in this coverage gap, and that means that they don't qualify for Medicaid because they either don't meet the very low income limits or the categorical requirements we talked about. But their income is not enough to qualify to go get help on the federal marketplace. if they have income, or they're projecting to have income below 100% of poverty, they're shut out from coverage. And that's one of the reasons, another very compelling reason why we need to be expanding Medicaid, because that's not something that happens in those 37 other states that have expanded. And of course, they're in a much better position than Florida now to make sure that their population gets the testing and treatment they need for COVID-19.
Okay. Thank you. Thank you for that. And that we talk a lot about Medicaid expansion. We talk a lot about just trying to get more people in Florida covered, and that would definitely help. It would change the game in Florida, definitely. So, Ann, is there a way for us to stay on top of some of the changes that are coming or that have happened with Medicaid, and then with the safety net programs like food stamps and WIC and different SNAP programs? So things seem to be changing every day, and there are all of these different packages. How do we know? How can people stay on top of what's happening?
Well, two things I would recommend. First of all, the Department of Children and Families is posting on their website, and I think we'll be making this link available. It's FloridaFamilies.com. They're posting this type of information about all the safety net programs, what changes they're making policy-wise, because it's happening so quickly, and of course it's not going through the normal channels. So really, the only way that the public knows that these changes are happening is if they go to that BCF website. The other way to track this is my organization, Florida Policy Institute, has posted something called the Florida Policy Tracker on the website, which is tracking these changes for all of the safety net programs. And we're hoping that that's going to be sort of a quick, helpful way for people to keep up to date on what is happening. And we're hopeful that there's a lot more that could be done to make it so that these safety net programs can really help people in this terrible time of need.
Okay. All right. Thank you. Thank you both. Those are the questions that we have so far for today, but I wanted to give you both just another minute if you wanted to take it. Is there anything that you'd like to add? Anything you would like to slide in these last few minutes about either the marketplace, Medicaid, CHIP, safety net programs? Any last words?
One other thing is our office is also very much watching what's going on with the reemployment assistance program, which has been incredibly difficult for Florida families to navigate. It has historically always been difficult for people to navigate, but now there's just such a crush of people who are having to use that system. And so I urge you to check out our website as well to get updates on what's happening with that program.
Okay, that's the unemployment.
That's right. It was renamed under Governor Scott. He renamed it to reemployment assistance, but it was formerly known as unemployment compensation.
Okay, reemployment assistance.
That's right.
Also formerly known as unemployment, so they can go to your website to get information. That's been the big talk these last couple of weeks. People just not able to get in.
Yeah, because people are not going to be able to access their additional benefits that they may qualify for under the federal law that was passed, unless they have to go through their state agency that administers the unemployment compensation program. So it's a real bottleneck at this point.
Okay, and we'll make sure we put both of your websites on the slides and on the information that we put out, because we definitely want people to talk to a navigator. That is extremely important. If you think that you qualify, I would not walk through the Medicaid process, the marketplace, CHIP. I would not walk through either one of those without a navigator. because your situation is so, everybody's situation is different, and you don't know all the nuances to those programs, to the applications. So I would say talk to a navigator and let somebody walk you through, and at the same time be able to educate you and explain to you exactly what your situation is, because that's what navigators are good at. I can tell you they are excellent at helping you understand your situation so that you know moving forward. So definitely reach out to a navigator, check out both the websites. Again, those are our questions for today. We have a comment section. As a reminder, you can get involved in the fight for Medicaid expansion in Florida by learning more at the Medicaid Matters Florida Coalition. We're at medicaidmattersflorida.org. I'm one of the story collectors for Florida Voices, and spend a lot of time talking with people across the state, from Escambia to the Keys, who are uninsured or underinsured, or who are having to pay lots of money for medications like insulin. So if you have a story that you'd like to share, also you can find that information on the Medicaid Matters site. Reach out to you, we can talk, and we'll capture your story, put it on our website, and let Floridians know. I mean, we're talking about 800,000 people in our state that need coverage and need care. So we want to put that out there. Jody, do you have anything you'd like to add?
No, I mean, I think you've pretty well covered that, particularly suggesting that people do reach out for that assistance. That's what they're there for. And, right now, I think people are pretty frustrated with some of the systems. And so, if you can get some help, I encourage you to take advantage of that help that's out there from the navigators.
Yes, awesome. Thank you both. You are both truly gems and great resources for this community and for our state. And so we appreciate your time and your knowledge, and thank you for sharing it with us. Okay.
Thanks, Jamika.
Thank you.
Have a good one.
Thank you. Bye.
Bye.